Live, a nice 59-year-old lady with two sets of implants. So her story is she got her first set in 2008, silicone implant. And then in 2018 thereabouts, she ended up getting a mammogram ultrasound that showed that the left side was ruptured. So she went to a plastic surgeon who removed the implant. Indeed, it was ruptured on the left. And the silicone slash implant was removed, and another silicone implant was put in 2018, and this is the set that she currently has. So she came to me with a second set, and from 2018, and this is just 5 years old. And so she was complaining of grade 3 contracture on the right and grade 4 on the left. Very hard, firm, and an exam that was very significant. So I've done what is 100% total capsulectomy. Remember, that's the whole goal. I cut out the excess skin plus the scar that you see. Look at this implant and look at this one. We're going to talk about this shortly. So I'm going to go ahead and cut this open. So overall, 100% of the capsule has been removed. And as you will see as I go in, this is what I see right away is a textured implant. So as I go in, remember, a textured implant from 18. Soon thereafter, remember, these were banned. So as you will see, I remove what is a Allergan 330 implant. As I put this here, remember, this is 5 years old. Look at all this fluid that's around. It's not enough to send for cytology, but this is the point to make. If I go like this is the gel bleed that occurs. That's the very slimy fluid that forms directly in the textured part. And this is the capsule. What I would say is very much consistent with what a typical capsule looks like. So now I'm going to go ahead and change my gloves. We're going to focus on the left side. And as you will see, this is just 5 years old. And this so she has a history of ruptured silicone that was supposedly not completely removed. And so the task and the goal of the surgery was to remove the implant capsule completely and to remove what were pockets of silicone that were indeed very much present, because once the silicone spills into the chest, it cannot be completely removed, no matter how long you have the drain or how many times or with how much fluid you wash the chest. So as you can see right here, this is the scar. I removed this tissue. This is what was at the lower inferior aspect. What is irregularities, masses that I noted, what is going to be sent separately. And I'm going to go ahead and write down. This is left chest mass. So by convention, all my implants on the left are on this side of the table. Now, so this is going to be sent separately, and we'll see what the pathology shows. Now, as I was dissecting, the implant was literally sitting like this. And as you will see, this is the fascia of the pectoralis minor. You can see those fibers, right? And in order for me, now as I was dissecting, you can see this is a very small hole. This is where the, see if you look, it's like my pickup can barely enter. See, this is the very small hole. Now, this is where I was able to plug. And just like the Facebook Live I did yesterday, there was no spillage. And as I go in, you will see over here, this is just 5 years old. Ruptured implant. And look at this. Just 5 years old. Look at this. And so if anyone, so as you can see, implants are very safe. Everyone should get them. And you can live like this. And obviously I'm being sarcastic. You know, look at this, just 5-year-old set of implants. And it didn't rupture yesterday. You can see it's literally been disintegrated. Look at this. The shell has broken loose. And obviously you got all of this contained. There was no spillage into the chest. I literally cleaned out the whole chest. And look at the capsule right here. Look at the color. You can see the capsule on the right, very different compared to the capsule on the left. And all of this was contained, none of this spilled into the chest. You can see some areas relatively thin, some areas thick. And this is going to be sent separately to pathology. So again, implants from 2018, ruptured on the left side, grade 4 contracture. Remember, majority of the ruptures are silent ruptures, meaning the patient doesn't know. And if you look at the guidelines, according to Allergan and Mentor, they say that you should get an MRI at year 3, and then every 2 years they're onward. So implants are absolutely not safe, be it textured, non-textured, smooth saline, or silicone. All of them are bad, no matter what. And the goal of the surgery was to remove the implant plus the capsule, as I did, in the manner without the need for the drains, and then removing that silicone from that previous 2018 surgery when she had, where there was a rupture and the silicone spilled into the chest. So I cleaned out the rest of the chest such that there is no inflammatory cells remaining behind. And we'll see what the mass, the left chest mass, shows when the pathologist reads it. So there you have it. This is Dr. Khan, Executive Plastic Surgery.